All right, well, welcome back. I'm sure diet and exercise on the forefront of a lot of people's minds here at the start of the new year. But for some people, diet and exercise just does not work. With us this afternoon is Dr. Rex Scheer. He's a surgeon at the Cahaba Valley Surgical Center, and he's here to talk about another option, and that's bariatric surgery. So before we even start on this option, explain, if you can, what bariatric surgery is for people who may not be familiar with it.
Well, it's a surgery that actually changes the anatomy inside the body, but the answer to the question why is because it works.
Okay.
This is a procedure or a set of procedures that in general we're talking about a 70% success rate. And when you compare that to everything else, diet, exercise, willpower, acupuncture, hypnosis, diet pills, you name it, nutritional systems and things, you're really looking at about a 2, maybe 5% long-term success rate. So 70% is not perfect, but it's way better than 5%.
That's correct. And then at what point should you just kind of throw, I wouldn't say throw in the towel, because you still have to adjust your lifestyle with these surgeries, but at what point should you look solely to these surgeries as a way for you, or a means for you to lose weight?
No question about it that surgery should be a last resort, and we want people to try other means. But for most people, this is not a defect in willpower or a moral defect. It's just their body is sabotaging them, and they just can't lose the weight. But to answer the question of who's a candidate, you really, there's an index called the body mass index, and patients with a body mass index over 40 or between 35 and 40 with comorbid factors, they are candidates for this. And this boils down to basically at least 100 pounds over your ideal body weight.
Okay.
But there are plenty of these calculators online where people can compute their BMI.
We were just talking about the two most popular, I should say, weight loss surgery options. One is the gastric bypass, the other the sleeve. You're saying the sleeve's becoming more common, more popular, is that right?
That's right. The gastric bypass is still kind of the gold standard against which everything else is compared. It's the most effective, but it has problems with malabsorption and some long-term complications that the newer, it's not new, it's not experimental, but the newer procedure, the sleeve gastrectomy, has much fewer of these long-term side effects, and it's almost as effective. So that's probably 98% of what we're doing right now.
So it's the new year. People are kind of reevaluating their health. If people kind of saw a snippet of this interview or they have more questions for you, how can they get in touch with you guys?
Well, we have a website, but it's under renovation. The best way is to call our hotline at Shelby Baptist Medical Center, which is 205-620-8831.
All right, thank you.